everyone. In the series of stretching, today we will be discussing the knee and ankle. So for the knee, special consideration is that the position of the hip during stretching, it influences the flexibility of the flexors and extensors of the knee. So the flexibility of the hamstrings and the rectus femoris, they must be examined and evaluated separately from the one joint muscle that affect knee joint. So to increase knee flexion, we have to stretch the knee extensors. So positions of the patient will be that he assumes a prone position. We stabilize the pelvis by applying downward pressure across the buttocks and grasp the anterior aspect of the distal tibia and flex the patient's knee. Now precaution is that we can place a rolled towel under the thigh just above the knee to prevent any compression of the patella against the table during the stretch. And stretching the knee extensors too vigorously in a prone position can traumatize the knee joint and it can cause the swelling. So in this way we will be stretching the rectus femoris and the quadriceps with the patient lying in prone position. Knee extension. So if we need to increase the knee extension in the mid-range, we have to stretch the knee flexors. Again, the position of the patient will be prone and we put a small roll towel under the patient's distal femur just above the patella. Now we grasp the distal tibia with one hand and stabilize the buttock to prevent hip flexion with the other hand, and slowly extend the knee to stretch the knee flexors. Hand placement and stabilization to increase mid-range knee extension with the patient lying prone. Next comes the ankle and the foot. Now the ankle and the foot, they are composed of multiple joints and we have to consider the mobility of these joints as well as the multi-joint muscles that cross these joints when increasing the range of motion of the ankle and foot. So increasing the dorsiflexion of the ankle with knee extended. So we have to stretch the gastrocnemius muscle, grasp the patient's heel with one hand and maintain the subtalar joint in a neutral position, and place your forearm along the plantar surface of the foot. Stabilize the anterior aspect of the tibia with your other hand and dorsiflex the talocrulial joint of the ankle by pulling the calcaneus in the inferior direction with your thumb and fingers while gently applying the pressure in the superior direction just proximal to the head of the metatarsals with your forearm. To increase the plantar flexion of the ankle, we have to support the posterior aspect of the distal tibia with one hand and grasp the foot along the tarsal and metatarsal areas. So we apply the stretch force to the anterior aspect of the foot and plantar flex the foot as far as possible. Now to increase the inversion or eversion of the ankle, they occur at the subtalar joint as a component of pronation and supination. So mobility of subtalar joint with appropriate strength is particularly important for walking on uneven surfaces. So we have to stabilize the talus by grasping just distal to the malleoli with one hand and we grasp the calcaneus with your other hand and move in the medial and lateral at the subtalar joint. Thank you.